doctor and get ourselves educated. I think what I've taken away from it the most from this conversation is just continuing to remember that people can be carriers, you can have no symptoms, and you can still hurt people that we love.
Correct. And I think I've heard many of the good things that you're doing. Keep on encouraging people to stay mindful, to care we have to care for each other, certainly. We're always going to be as weak as the weakest one of our population is.
Right.
The ones in disadvantage could ultimately get sick and then get us sick and the other end of the equation. So care for each other, care for the elder, donate food to whoever needs one. Ask your elder if they need for you to do groceries for them. If they are a home of several family members, pick one to do the groceries, and then just try to minimize the exposure time and try to be really careful when you do.
Thank you so much. Thank you so much for everything that you do all the time, not just now, but especially right now. And thank you for being on Bright Minded. You're the man. Thank you, Dr. Oscar.
You're very welcome. And I'm looking forward to seeing one of your face masks. I would love to wear one in the hospital.
I actually painted, I will send you some pictures. I painted this weekend. I had gotten some of my masks. Jeremy Scott had an idea of repurposing some old scarves, turning them into masks so you could make more than one. So it's great. I made a Gucci one. I'm all about it. So thank you so much.
Thank you. I'll see you.
Bye. That was amazing. The entire time I kept feeling like my eyes just started to water because you can just tell that these doctors and these healthcare workers are just like totally exhausting themselves and working so hard to keep us all safe and healthy. So just super, super inspiring. To talk to another amazing doctor, we're going to talk to Cyrus Madad. That's our next guest, Dr. Cyrus Madad, who is a nationally recognized leader in public health and special pathogen preparedness and response. She is the Senior Director for New York City Health and Hospitals Special Pathogens Program, and you may also recognize her from the 2020 Netflix docuseries Pandemic: How to Prevent an Outbreak. So in addition to being a badass public health leader, she's also a mom of 3 kids. She's been helping lead NYC's response to the pandemic, coordinating the efforts to expand capacity for COVID-19 patients, like working with local hotels to convert them for patients, for example. So this is an honor to connect to this next hero. So let's do it. While we wait, here, come here, buddy. Right here. Oh. If you notice, I washed my hair, which I realized I had not washed my hair since Elton John. I never thought that would be a sentence that came out of my mouth. Oh, I haven't washed my hair since Elton John, which was like 10 days ago. Yes. Dr. Madad is joining. Okay. Cyrus Madad, connecting now. Hi.
Hi, how are you?
So good to see you on the screen. This has just been such an amazing beginning for our Heroes Week. I just had an amazing conversation with Dr. Oscar in New Orleans, and now getting to hear from you in New York. I wore one of my favorite New Yorkers, Debbie Harry, just for you.
Thank you. I love it.
There's such a magic of the city. I've got to spend so much time there, and just so much history and so many iconic artists from New York. So it's just devastating to know that it's being hit so hard with this, with COVID-19. So I'm just really happy to get to spend a little bit of time with you. And I'm just honored to talk to a woman who shows us that we can really have it all and do it all, of balancing your passion and your dreams and taking care of people, but also be an awesome mom. I watched Pandemic on Netflix, and so I was just super inspired by you and how you balance that. And I have a feeling that it could be even more challenging in a time like this. How is that, balancing being a mom at this time and the stress that you're under?
Well, and first, thank you for obviously all the comments you made. I think for me right now, it's one of the most exhausting periods of my life, but it's also one of the moments where I'm extremely proud of everything that's going on behind the scenes with healthcare workers and, the amazing fight that they're fighting in combating COVID-19. I have 3 children. I actually had a baby. She's actually 12 weeks today. So she's my pandemic baby. I actually delivered her 6 weeks before the first case of 19 hit New York. And then a week after I delivered her, I went right back to work because we knew that this was something that's going to impact New York City and New York State, given that it's a melting pot, given how, it's the international hub we have in New York City, over 8 million people, and we knew this is something to prepare for. So, my family and my kids have been very supportive, but it's certainly obviously a very scary time for everybody.
Wow, I could not even imagine. That's just so, I mean, I'm just so inspired by you of like your dedication. And I feel very taken care of knowing that you and people like you exist, for people like me and keeping everyone safe and healthy, and just knowing that you're there makes all of us be able to just feel more protected, but it's still just a really terrifying time for everyone. I wanted to ask you, how do you stay inspired? Is it your family? How do you stay encouraged? And then what would you tell other fellow healthcare workers that may be watching now that are struggling during this time? How do you do it? How do you stay light?
It's definitely very difficult, and this is probably the biggest marathon of all of our lives. Not just for those that are healthcare workers, those are on the front lines behind the scenes, but even just the general public. The United States hit a huge milestone where all 50 states are under a declaration of disaster, if you will. Everyone obviously sheltering in place, social distancing, staying home. Nothing like this has ever been seen before in U.S. history. And so this is, a team effort. From a healthcare perspective, it takes a village to respond to this type of incident. It's not obviously a one-person team or a one-man show. It really takes an entire village, an entire healthcare system to respond to this growing epidemic. You're seeing in New York City that the number of beds that we're trying to continue to add for the potential ongoing surge of patients. Each one of those beds that's coming online in the hours to come, days to come, represents a courageous healthcare worker that's going to be taking care of a patient in that bed. And so this is something where we all need to come together as one, not just as one government, but as one society, because we're all in it together, and every one of us plays a part in this pandemic. I always get to, some people always ask me, what can I do, as just a general person. I'm not a physician, I'm not a nurse, but really, in order for us to get to the post, COVID America that we're trying to get back to our normal life, there's really 2 main things that all of us really need to do. And the first is we need to continue to abide by these social distancing measures. We need to continue to change our behavior. So these everyday measures that you see public health workers constantly harp on, washing your hands, covering your cough, staying home, things like that. Those are the things that are actually flattening the curve. So I'm sure everyone has heard about flattening the curve so many times, but that's what it's doing. But the other aspect is, staying informed and going to credible sources. There's so much misinformation out there. And even my own family member, they're constantly texting me of, do you think this remedy works, and should I do this? It's completely not based on science. So this is a time for science to speak. This is a time for people to really, listen to those that are in the field to get their advice and to make sure that they're following through.
So we talk a lot about reliable sources on this show. We've talked about, reliable source can also be just, in reliable sources, when I kind of talked about it for my kind of fans, have been, not gossipy text chains, not social media, not random tweets, not family members or your drama-loving friend that loves to send you every clickbait interview. Be very protective of yourself and the information that you put in, because our thoughts determine how we're going to feel. So anxious, misleading, clickbaity information makes us all feel panicked. And, for me, I know that a lot of my anxiety can actually cause things that could be mistaken as symptoms, like shortness of breath from holding my breath, and then completely putting myself into an anxious spiral. And it's really important that healthy people stay out of the hospitals. And so those that are really affected can get the treatment and attention, because, you know, anyone in the hospital that shouldn't or couldn't be there, one, right, you're exposing yourself to those who are sick, but also you're taking away the attention from those that really, really need it. So it's really important that the healthy or asymptomatic, right, stay home and isolated rather than causing anxiety or fear. Anxiety attacks can bring on some of those symptoms and make you feel like you need to go to the hospital. And it's really important that what would you say to, what are the symptoms that would make you want to go to the hospital? What makes you stay at home? Where's the line?
So, and that's a great question, because with COVID-19, it's a very large spectrum of illness. A lot of people, you know, either they are pre-symptomatic or asymptomatic, or either they have a mild version of the disease or they have a very severe or critical version. So, you know, a lot of people fall under those different buckets. But in terms of when to see a healthcare provider, if you don't, you know, get better with 24 to 48 hours, certainly make sure that, you know, you call your healthcare provider. But really, one of the key symptoms is if you start to experience that shortness of breath, it's really time for you to you know, get medical help right away. And that's very important, because what you're seeing, at least here in, you know, New York State, New York City, the number of people that are dying in their home has, you know, quadrupled. Usually you see on any given day before COVID, you know, a handful of people dying in homes, over 20. We're seeing 200 people now, majority obviously related to COVID. So make sure that you seek healthcare services if you need to. But I think another important concept is everybody understands first line of defense, second line of defense, third line of defense. Our first line of defense is our everyday measures, our social distancing. If we're able to stay home, if we're able to, you know, cover our costs, stay healthy, that should be our first line of defense. Our second line of defense is need to see a healthcare provider, a hospital. We're going to be here for you. We're going to treat every single patient that walks into our doors and give it our all. We're going to give the same, you know, type of care to every single patient, regardless of your ability to pay, your immigration status, you know, your racial profile. None of that matters. We're going to give the best care possible. But at the same time, knowing that we're in a crisis situation, this is something that we have never experienced before. Hospitals are getting overwhelmed. Not something that we're used to. We're in a crisis standard care type of environment. And so while you're going to get that great care, at the same time, we want to make sure you're staying out of the hospital if you don't need to go to a hospital. So other people that actually need it are going there. You know, a lot of people also, it's hard for them to kind of get into the thinking of, well, you know, I'm healthy. I don't feel, you know, that I have COVID. I can just go out to the grocery store and kind of do what I need to do. But it's not about you. And the reason why I say that, it's about the new chains of infections that you create. So you may not even know about it. You may be a carrier and you go out to the grocery store, and unfortunately you have other people there that may not be, you know, keeping that social distancing of 6 feet, and they're in the aisle, and they, you know, you go ahead and you infect them by, you know, the means of transmission. They then go home and then they can infect their grandma, their children, and then that starts off a whole new chain of transmission. And what we know about this virus is every one person that gets infected can infect at least, you know, 2 to 3 more people. So you're going to double that, then quadruple that, you know, and that's how these new chains of transmission start. So, you know, that's why I say it's not about you. You can infect other people without even knowing it.
I was thinking a lot about, you know, I'm someone that I'm very, like, I love people and I love meeting new people. I love talking to people. So this has been really challenging for me, who just loves to connect. So that's why I created this digital platform, so I can still do it. I can still feel like I can give you a hug and thank you without touching or putting you at risk. So there's just been a lot of ways that I've been trying to get creative that I feel like I could still make an impact on someone without having to get near them or put them at risk in any way. So one thing that I've been doing is like wearing really funny shirts that say funny things or have funny pictures on them to the grocery store, because it feels really weird to, we're not used to this society where like I'm supposed to keep my distance or not hold the door for someone, or it just feels, it's really hard to retrain yourself of what's appropriate. And you know, like even when I have done my essential shopping, which I try to keep to a minimum, it's like you almost really have to continue to remind yourself or write it down somewhere to say, make sure you're keeping your distance or whatever you need to do, because I feel like that's been the hardest thing for me to stay consistently reminded of is the actual distancing when I do have to do my essential outings.
Yeah, and you're certainly not alone. I think, a lot of us are in that social environment, or that whole person type structure. And it's very hard, but this is where I think once we overcome COVID-19, and where there's going to be a light at the end of the tunnel. This is not something that's going to go on forever. But in order for this to be done faster, it takes all of us. It's not just the government that knows these measures, but all of us play a role. But I think what we're going to see is after this is all done with, is people are probably going to be very reluctant in shaking hands, hugging each other, because they're going to remember what infectious diseases do. So this is obviously just one infectious disease. Seasonal flu is something we see every year. And it spreads very similarly through the respiratory route. People coming in close contact with one another. So I think generally what's probably going to happen is people are be more reluctant and in terms of making those close contacts, which it's kind of a double-edged sword. So one of those things.
Yes.